Hello everyone, welcome to my YouTube channel. My name is Onesimus and you're on Onesimus the Fashionable Nurse. In this tutorial we are going to look at typhoid. We are going to look at typhoid. We are going to look at the definition of typhoid. We are going to look at the cause of typhoid. We look at the epidemiology. We look at risk factors of typhoid. We look at signs and symptoms, and then we'll look at the prognosis of typhoid. But before we continue, if you are new on this channel, please consider subscribing by hitting the subscribe button in the corner down here and click on the notification bell so that you will be the first person to receive the videos whenever I post. Thank you. By definition, typhoid is a bacterial infection that is caused by bacterium Salmonella typhi. It is spread through taking contaminated water and contaminated food, or through direct contact with pee or poo of an infected person. Epidemiology. In developed countries where there is constant supply of clean water and improved sanitation, typhoid has been suppressed. But in some areas of the world, like Africa, Asia, Latin America, where there is poor sanitation and unlimited supply of clean water, typhoid is still a problem. And according to World Health Organization, 11 to 20 million cases of typhoid are reported every year. And out of these, 128,000 to 161,000 cases die of typhoid. Most of the categories who are affected with this infection are the vulnerable and the children who have low immunity. Then if we are to look at the risk factors, number one, we have unhygienic practices or poor hygiene. For example, failure to wash hands after visiting the toilet or before eating. Because as we discussed before, we saw that this infection can be spread through getting in contact with poo or pee of an infected person. Now imagine this person has visited the toilet and they have used, most especially flush toilets, and they have used the system to flush the toilet. And now you have also used the same toilet and you have touched on the same system to flush the toilet, you can contract that disease. Then second is poor sanitation, whereby there is no good supply of clean water, is poor waste disposal. Here you can easily contract this disease. Then traveling to affected areas. This is mostly to these people whose work involves a lot of traveling. If you keep on visiting most affected areas every time you can end up getting that infection, because at any time you will handshake with someone who has the infection, but especially if their hygiene is not clean, is not good also. And now after handshaking with that person and you also don't wash your hands, you get, or you anytime you touch on the surface of where that person has touched, you get the infection from there. Then getting in contact with people who have the infection. Now let's look at the signs and symptoms. We look at the signs and symptoms. Most of these signs and symptoms, they come within 1 week to 3 weeks after exposure to the infection. but sometimes they can come within 3 days to 30 days after exposure to the infection. But there are also some individuals who carry the infection but they don't show the signs and symptoms, but they keep on spreading to other people unknowingly, and you find most of these people have stayed with typhoid infection for a long time, but they don't know because there is no any sign and symptom which shows that they have. Some of the signs and symptoms of typhoid include: number one, fever. Fever which keeps on increasing gradually up to 39 to 40 degrees Celsius. Then secondly, chills. You feel like your body is cold. Then also loss of appetite. When you have typhoid, there is loss of appetite. Then also stomach pain. There is also abdominal pain. Then there is also rose rash. There are some rashes which appear on the chest and the abdomen, which are pink-like. So if those rashes appear, we suspect typhoid. Then there is also dry cough. Someone who has typhoid, there is also a possibility of developing dry cough. Then there is muscle pain, general muscle pain, which is also called myalgia. Then there is headache. Then also sometimes there is nausea or sometimes there is vomiting. In severe infection, there is vomiting. Then also there is constipation when it is starting. But in severe infection, we have diarrhea. Then we have delirium, which characterized by erosions. Then we have also confusion. These signs, they come in severe infection or later infection. But the cardinal signs for typhoid are fever and rose rash. The rose rash is always not shown in many patients. Then we look at the prognosis. If typhoid is treated earlier, it can heal within 10 days. And within 3 to 5 days, you are supposed to be feeling improvement. But if it is treated at a later stage, recovery may take up to 3 weeks. And if it is a relapse, the recovery may take more than 3 weeks. We have reached at the end of our tutorial. Thank you for watching this video. Don't forget to subscribe, like, and in case you want to share with me something, or in case you want me to discuss about something, please let me know by putting it down in the comment section. Thank you.